when I joined, one of the pain points I saw as a pediatric oncologist is we had a lot of delays in diagnosis in young kids with brain tumors. And that was primarily because of failure to get imaging in a timely manner. Because a lot of people were practicing in the older management style when it was all about cost. So you started with plain film, and then you went to ultrasound, and then you went to CT, and then you went to MRI. And as it happens in young kids, most of the brain tumors are posterior fossa, and the CT doesn't see that well because their cranial vault is so small, there's so much scatter, and unless they're severe enough that they've got hydrocephalus, you're not gonna get it. So our standard is always just, if you really have reason to suspect a brain tumor in a young child, you should just go straight to MRI. So we wrote that into the guidelines right away and got that out there. And I had so many peer-to-peers early on where the physician would get on the phone and they'd be just yelling at me, how are you denying a CT? There's this child and I'm worried about a brain tumor. I was like, I know, because I don't want you to get the CT, I want you to get an MRI. And they're shocked and go, you mean you'll give me an MRI? I'm like, yeah. I said,
a more expensive study?
I said, yeah, walk me, but yeah, so the savings opportunity here isn't skipping the MRI, it's skipping the CT. I said, because if you get a CT scan and it's positive, you're going to need an MRI because there's not enough detail, right? And if you get a CT scan and it's negative,
you're going to need an MRI.
You're going to need an MRI. Okay, so let's just skip. That's the perfect example of getting to the right thing for the patient right away. You get a better answer, the patient moves forward with care, and the health plan saves money on the less expensive study that was unnecessary.